record to this
Oh,
computer.
yes.
Okay,
Okay.
yes. Okay.
Okay, I
And
think we're good. All right,
Awesome.
hopefully we are. If not, I'll just re-record it. It'll be fine. Um, okay. All right. So before we get started, I actually want to do something well, it's not active, it's active for me, but for you guys, I want you to experience just a taste of mind-body medicine. Obviously, mindfulness is a really big part of DBT, but it's a huge part of the mind-body work that I like to do. So I just want you guys to experience it. So if you're comfortable, go ahead and close your eyes. We're going to start by just taking a deep inhale in through your nose. Feel your chest rise. And then a slow exhale out through your mouth. Another deep breath in and release. As we start to settle in, I'd like you to just draw some awareness to your body. Notice any points of contact, maybe the weight of your body on your chair, your feet for firmly pressed against the floor, or your hands resting naturally. Without any judgment, simply observing what's present for you right now. Any tension, maybe relax your eyebrows. Swallow a few times, that'll release your throat. Now shifting your awareness to your breath. The steady rhythm of the inhale and the exhale. No need to change or manipulate it, just observing. Each breath is like a little anchor, just gently bringing you back to this moment. Your mind will wander to what you've had going on earlier, what you've got to do later, and this is just a practice to give yourself permission to just be. If thoughts arise, that's completely normal. Just notice them. And then with kindness, just bringing your attention back to that anchor. There's nothing to fix or to force, just to practice being here and fully present. As we prepare to transition into our time together, just take a moment to maybe think about what brought you here today. Perhaps it's just curiosity, supporting a coworker, openness to this topic. Whatever it is, whatever resonates with you, just hold it gently in your awareness. Begin to deepen your breath, bringing small movements back into your fingers and your toes. If your eyes were closed, maybe gently flutter them open, letting the light come back into your line of vision. Take one more final moment to just breathe and notice how you feel in this moment. Because this is a safe space, I like to introduce a little bit of scripture into these practices. And the verse that has been heavy on my heart the last several weeks is, "Come to me, all you who are weary and heavy laden, and I will give you rest." And a meditation like this is a perfect example of how we, as he asks us to, come to him. He doesn't just say, "I'll give you rest, that'll be great." He says, "Come to me." So maybe taking one more deep breath, just allowing the Lord to hold you in this moment and to carry you through the rest of your day. I know we started a little bit slower today, but I'm going to slowly just transition us into our educational portion of today. If at any time you want to pause, take breaks. This, just like yoga, this is your practice. This is your school room. So don't feel any pressure if you need a little bit of a break to digest some of the information. But we are just going to start out from the very beginning. So a lot of people are very wary of mind body medicine. They think it's very new age, very woo woo. And I will not lie, there is a lot of it that is. That being said, I like to focus on the biological and psychological principles of some of these practices and how we can integrate them into more of a holistic approach to our own lives, but also the treatment of our patients. So, mind body medicine is a field of healthcare that acknowledges the deep connection within this wheel that you see here. It recognizes that our thoughts, emotions, beliefs, and behaviors have a profound impact on our physical health. So rather than treating the body as a machine with separate parts, mind body medicine embraces a more integrated, it's also called integrative medicine approach that focuses on how psychological, social, spiritual, and all of the things that you see here influence overall well being. So to just, okay, we have our little phrase here. The mind and body are not separate. They constantly shape our health, well being, and our capacity to heal. So if you just think about it as, I don't know, like a 1,000-piece puzzle, we're putting all of these pieces together in a way that makes sense. Kind of like what we do with like a psychosocial evaluation. We get all the pieces of the puzzle to better understand the picture as a whole. So what is mind-body medicine? The concept is not new. Ancient healing traditions from traditional Chinese medicine, or if you've heard of Ayurveda, indigenous healing practices, they have long understood the link between the mind and the body. And for thousands of years, healing was not just about treating symptoms, it was about restoring balance. So in Western medicine, this connection was largely overlooked, and I would say still is. It's not very often that you go into your PCP and they say, well, how's your spiritual life? But that can give us a lot of information as to all of the different things that might be going on with the person. So the dominant biomedical model treats the body as separate from the mind, focusing primarily on physical symptoms. But in the 20th century, research began to challenge this perspective. So a major turning point came in the 60s and 70s when a man named Dr. Herbert Benson at Harvard, he studied meditation and coined this term called relaxation response. So his research showed that practices like meditation, deep breathing, guided imagery could lower blood pressure, reduce cortisol, improve overall health. And around the same time, y'all will probably know this man, but Dr. John Kabat-Zinn brought mindfulness into medicine, using it to help patients manage chronic pain and stress-related disorders. And I don't know about y'all's clients here in Hattiesburg, but I've had many who come in with diagnoses, whether they're autoimmune or fibromyalgia. I see a lot of that here. And these are all just really important examples of from a biomedical model, there's not a lot of ways that their doctors can help them. But if you come from a holistic perspective and say, right, let's look at all of these domains and what might be contributing to this dis-ease in your body. It's just something to hold in mind. Chronic pain is another one, chronic back pain or GI distress. These are all symptoms that there could be something going on psychologically, not just biologically. So I know I'm throwing a lot y'all's way. I promise we'll get to the fun stuff. I didn't do very good with my slides. So we already kind of went over the brief history here. Western medicine separates the mind and body, and traditional Chinese medicine, Ayurveda, they all incorporate the mind-body connection. Okay, So, mind body medicine today. Today, mind body medicine includes practices like mindfulness, yoga, breath work, biofeedback, which is really, really cool. And that's probably another presentation. But I got to take a really cool course at school on biofeedback. And that's essentially using things like heart rate variability, the temperature of your skin, your sweat, to really get an idea of your nervous system, response system throughout the day. And using that as, again, just more data to help you treat your client. Other ones, hypnosis, guided imagery, or expressive arts therapy. These techniques are all widely used in psychotherapy, integrative medicine, and trauma recovery. So, what's powerful about this field is that it empowers patients. Instead of just treating disease, it engages the whole person, mind, body, and even spirit in the healing process. So, research continues to show that practices like meditation and breath work can reduce things like inflammation, strengthen immune function, and even change the brain through neuroplasticity, which is like the coolest thing in the world. And this is a side note, but
Crazy.
um, Dr. Caroline Leaf. She is a Christian, I think she's a neuroscientist, but she has a book called Switch on Your Brain, which is all about neuroplasticity, practical ways to start to integrate that into your life. It's a fantastic book if y'all are into that kind of thing. Right. So why it matters, it engages the whole person. Bum, bum, bum. Okay. So why this matters to us. As mental health professionals, we have a unique opportunity to integrate these approaches into our work, whether it's helping a client manage anxiety through breath work or using mindfulness to prevent burnout. But mind body medicine reminds us that healing is not just about what happens cognitively, it's about the whole person. So before we move into the nervous system, one question I might ask you guys to just think about for maybe a minute is, how might the perspectives I've shared so far enhance the way you approach your work as well as your own well-being? So I'll give you guys just like 20 to 30 seconds to just kind of think about how this information might navigate either your personal life or your professional life. All right. And if I caught you in the middle of a thought, maybe it's something you jot down to come back to. And then we'll have time for questions or discussion at the end. But this is where I really like to nerd out. This is really what drew me to mind body medicine. And this is really where my passion for research is. This is the foundational idea behind what just stimulates me and makes me curious. So you've probably heard of the autonomic nervous system, but that is essentially the stress response system. So that is our body's command center. So the autonomic nervous system, also known as the ANS, though we rarely think about it, this system is working behind the scenes in our bodies 24/7. It's there to keep us alive and to regulate everything from our heartbeat to our digestion. And understanding the ANS is essential not just for medical professionals, but for anyone interested in health, stress management, psychotherapy, and mind body medicine. So, what is it exactly? The autonomic nervous system is a part of it's called the peripheral nervous system, and that means it operates outside of our conscious control. So, unlike voluntary nervous system, which allows us to move our muscles intentionally, the ANS controls the automatic functions of the body, things like heart rate, blood pressure, respiration, digestion, even pupil dilation. You don't have to tell your heart to beat or remind your lungs to take in oxygen. It's taking care of that for you. So we're going to move into um, the two main branches that you hear talked a lot about when it comes to the autonomic nervous system. So the two primary branches, the first, I'm sure you're very familiar with this, but the sympathetic, the fight or flight, the gas pedal. Um, think about it as the body system's accelerator. It prepares us to deal with threats. When the sympathetic is triggered by stress or danger, or sometimes even excitement, if you hear like butterflies in my stomach, it causes a cascade of physiological changes. Increased heart rate, rapid breathing, dilated pupils, increased blood flow to the muscles, suppressed digestion. So, this response was designed for survival. Our ancestors needed it to escape predators. But in today's world, chronic stress keeps the system overactivated, leading to anxiety, high blood pressure, trouble sleeping, so many different health conditions and concerns. Number two is the parasympathetic, also known as rest and digest or the brake pedal. Um, if the SNS is the gas pedal, the parasympathetic is the brake. So when the PNS is engaged, the body slows the heart rate, promotes digestion, encourages deep, slow breathing, lowers blood pressure, supports healing and immune function. So this is the state we need to be in for long-term health. But many of us and many of my clients struggle to access it because of chronic stress, screen time, modern lifestyle. There's so many reasons that we can chronically exist in that sympathetic. So Marnie probably could tell us a lot about this too. I feel like I've heard her talk about it, but a key player in the parasympathetic system is called the vagus nerve. So it is the longest cranial nerve in our bodies, and it basically acts like a superhighway between the brain and the body. It influences the heart rate, digestion, and even emotional regulation. So, stimulating the vagus nerve through deep breathing, meditation, humming. I mean, there's so many different ways to do this. Rubbing the side of your ear. There's a lot of really random ways to stimulate your vagus nerve, but it can activate like immediately that parasympathetic response and help shift the body into a state of relaxation. So, vagus nerve stimulation can be really, really helpful for clients when they're starting to become really activated and maybe they're talking about an emotionally charged topic. These are basically like DBT skills. There's a lot of interconnections between the two, but that's just some of the biology behind what's happening. All right. So balance is the key, which is always a practice, but it says neither the sympathetic or the parasympathetic is good or bad. We actually need both to survive as human beings, but the problem comes when we get stuck in one of these states. So chronic stress can keep us stuck in fight or flight, leading to burnout, anxiety, disease. On the other hand, if the parasympathetic system dominates too much, it can result in low energy, depression, sluggishness. So the goal is really finding a healthy balance to the best of our abilities and just knowing that a healthy nervous system can shift between these states as needed. So, how do we regulate this thing? How do we figure it out? How do we know what's what? Luckily, we're not completely at the mercy of our nervous system because science shows that we can actually influence it through simple practices. So, number one, breath work. Slow, deep breathing activates the parasympathetic system. Mindfulness and meditation, they can calm the nervous system and improve the vagal tone. I also like to add prayer in that mindfulness and meditation because it shares a lot of similar biological elements. And then you're also bringing in that influence of spirituality if the person is open to it, just depending on your therapeutic relationship and what they're comfortable with. Movement, yoga, Tai Chi, and walking is a huge one. I didn't realize the power of walking until it was explained to me, kind of like EMDR. So you have I need Marnie for this too. I just need her a lot today, apparently. But there is the maybe one of you guys can tell me the bilateral stimulation. That's what I'm looking for of the tapping that happens in EMDR. The same thing is happening essentially when you're walking because you're going back and forth. So some clients will be like, "Really, you're telling me to walk?" Like, yes, for many different reasons that would take me this whole presentation to go into, but just try it.
Like,
Another one
like
is,
it doesn't
I'm
it
sorry.
use it causes you to use both sides of your brain. Correct?
Believe so. That's a very simple, helpful way to put that. So, yes, I'm sure there's other, probably pottery too. Shannon, would you agree that that's something that kind of engages both sides?
Oh yes, absolutely.
Yeah.
Love
I'd
it.
imagine that's definitely a form of mindfulness and movement and social connection, like all of the things. So it's not as limited as to what I'm giving you guys, but this is kind of just the foundational pieces. Um, Yeah, and then the last one, social connection, eye contact, laughter, physical touch, they can all engage that vagus nerve that we were talking about. So, the autonomic nervous system as a whole is a silent conductor. It orchestrates the rhythms of our body without us even realizing it. By understanding how it works and learning how to engage our parasympathetic system, we can improve not only our physical health, but also our emotional resilience and well being. So, one more question before we shift gears one last time. Just to consider, how can I bring more balance into my own nervous system? I'll just give you a second to think about that. Deep breath in. So, just for today's purposes, I'm only going to go into one more topic because I know I've given y'all a ton so far, and I don't want to overwhelm this presentation. But this topic is very much related to what we've already talked about, and it's essentially a it's a theory. It's a school of thought regarding the autonomic nervous system. It's called, you might have heard of it before, but it's called the polyvagal theory. So when I learned about this, it absolutely changed the way I viewed my own nervous system, and it changed the way I practice clinically as a counselor. Because to me, it was a very digestible way to understand what I was experiencing, whether it was conscious or not conscious. It really helped to bring this kind of turned on a light for me when it came to understanding this stuff. So the polyvagal theory, let's see here. It was developed by Dr. Stephen Porges in the 1990s, and it explains how the autonomic nervous system helps us navigate the world, determining when we feel safe, threatened, or shut down. So traditionally, we've understood the autonomic nervous system as having two branches. That's what we talked about earlier, the sympathetic and the parasympathetic. But Porges discovered something deeper. Not all parasympathetic responses are the same. Instead of a two-part system, the vagus nerve actually has three pathways that guide our reactions to the world. So these pathways shape our ability to feel safe, connected with others, and to recover from stress. So, um, I'm going to give you guys a little spiel of how I share this with my patients in session. So, we have our three states of the nervous system here. I actually like to think about this as a ladder. If you imagine your nervous system is a ladder. So, at the very top, we have it's called the ventral vagal. That's also the parasympathetic. That is when we feel at ease. We can manage stress as it comes. We can regulate our emotions in a healthy, it's the primary place we want to be, right? But as things happen, stress, transitions, maybe a big move. As things happen, we move into the sympathetic, which is the fight or flight, which again is there for a reason. We need our fight or flight stress response system. But what happens? Chronic stress, whether that's from um, work stress, financial stress, an unhealthy relationship, whatever it is, we chronically can stay in that sympathetic, which basically wears our mind and body down. It depletes us emotionally and physically. And when that happens, we drop down to the bottom of the ladder, which is called the dorsal vagal response. And essentially, what that refers to is complete emotional and physical depletion. So that's when you're going to see a lot of these symptoms of depression, hopelessness, maybe suicidal ideation. So a lot of the clients I work with, they are oscillating between that dorsal vagal, like what's the point? I can't even get out of bed, back to that fight or flight of, oh my gosh, now I'm so worried about A, B, and C that I avoided. And they're just going back and forth between those bottom two. So you can imagine how exhausting that could be on them physically, but also psychologically. All right. So, why does the polyvagal theory matter? So, understanding it shifts the way we think about stress, trauma, and healing. So, instead of labeling emotions as bad, we see them as adaptive responses to a perceived safety or threat. So, for example, if a client is struggling with social anxiety, they may not just be shy, their nervous system might be stuck in a state of hypervigilance, right? That sympathetic activation due to past experiences. Conversely, if someone is experiencing depression or dissociation, um, or someone experiencing depression or dissociation isn't simply unmotivated, their nervous system might be stuck in that dorsal vagal shutdown, protecting them from overwhelming stress. So, by recognizing these patterns, we empower clients to A, have language for what's happening, but B, to move towards regulation, parasympathetic, and connection with others. So, what I find really cool is I will have clients come in, and again, this is a theory, it's not necessarily a scientific, proven method that you're going to find in medical school. But because I've given my clients language, they'll come in and say, you know, I really notice myself. I think I'm in that dorsal vagal area. And that's so helpful because it gives us a foundation to work from. Um, so we are rounding out here. These are just ways to kind of support the nervous system regulation, things we've really talked about this entire session. So, breath work and mindfulness, movement and play, co regulation. So, co regulation, I've been looking a lot into as well, because if I have a client come in who's really dysregulated and maybe it's a kid, and we're trying to figure out what to do, if I can mirror that with a parasympathetic response, usually they'll kind of meet me there. If I don't, I know that's pretty basic, but if I don't get up in that with them, that co-regulation can help with the emotional regulation. Um, Eye contact and facial expressions, smiling, laughter, social engagement activate the ventral vagal. And then humming, singing, chanting, other things that stimulate and promote relaxation. So, at its core, polyvagal theory reminds us that healing begins with safety. Whether in therapy, relationships, or self care, the nervous system is constantly asking, am I safe? So, when we can understand this, we can move beyond judgment into curiosity, compassion, and connection. So, I promised you guys I'd give you kind of a practicality to take into your sessions. This is one of my favorite. So I have these two paper dolls here, and I want to give credit where credit is due. I had a coworker who did Brene Brown's Daring Way clinical training, and she actually shared this with me, so I'm going to give her all the credit. But what's really cool is you have these two paper dolls, and as you're helping clients understand their body states, I'll even have three for the polyvagal theory. You have them just draw, illustrate right where they notice, right, that hypervigilance or that sympathetic in their body. What does that feel like versus the parasympathetic? Another way to use this, that comes more from Brene Brown's is to hone in on one particular emotion. So, to use shame, for example, to have the client draw or write out where and how they experience shame in their body. And they may need some time because a lot of us, I know myself included, haven't really thought about this. So, when I experience shame, gosh, what does that feel like? Oh, maybe there's like a knot in my stomach, or I just want to like curl into myself, I might draw this on the body, on the paper doll. And really, the idea is just help clients better get to know um, not only their body states, but maybe individual emotions as well. So I just want to give you guys a moment. It's okay if you don't have any questions, but is this something you could see yourself using in the therapy space? What are your thoughts about this?
I like it. I do like. I know that Lindley and I have talked about this before, but I get a lot of my clients to draw pictures of themselves already. So like I've always kind of used like the drawing in my therapy, like whether that's they're drawing a picture of something or how they feel, or if their feelings were, weather, what would it look like? What would it be outside? And so, like, I would definitely use that. I think that's really cool to for them to be able to pinpoint where it is that their body is holding it.
I will
Yeah,
say, I
absolutely.
mean, I love the idea of like weather. That's such a creative idea that it's probably even more relatable than having to go internally. Maybe if they have a lot of trauma, that could be too close. So thank you so much for sharing that. That's a very cool idea.
Yep. Yeah, I had a kid. I asked the 4-year-old Anna that I was telling you about,
Yeah.
that I just started seeing. I had him draw like himself and a picture of his family just last week. But I've more so, just verbally like talked with clients about, hey, well, where are you experiencing that? Or where do you feel that in your body? What does that look like? And so I've never gotten them to draw that specifically. I almost feel like that would make that easier, for them to like, see that paper doll and draw that, allow them to think about it a little bit more. And so I would definitely use that. I think that's helpful.
Yes.
Thank you for sharing that. I just love to, though, you normalizing that self-inquiry in session of just regularly bringing up those questions. I've imagined that's so helpful for clients when they leave your space because that's something that they're thinking about, right? Well, Lindley asks me this all the time. Maybe I should ask it. So I just love that you're familiarizing that with your patients. And maybe this could be a fun complement to that if they're open to it.
Mm, yeah.
Okay. And the last thing I wanted to share with you guys, again, I really love instruments, and there's a ton of instruments, but there's not one for kind of the school of thought because it is pretty under researched. There's a ton coming out, but there's not a lot that's consistent. So I took it upon myself. This is not a validated instrument, but it's helpful for me. I made my own. So it starts with the adverse childhood experiences because there's so much interconnection between trauma and nervous system dysregulation. So that's going to be the first portion of this instrument. And then the second section is on in the present moment. Are these certain patterns or symptoms that you are experiencing that are highly correlated with nervous system dysregulation? The third one is going to get a better idea of their coping strategies and or lack thereof, maybe things that are making it even worse, right? Scrolling on your phone, not a horrible thing by any means, but it's going to keep you stuck in that sympathetic, like always kind of needing that dopamine. And taking you out of your body essentially. So I have just a lot of different questions to kind of give me an overview of my client and kind of their level of insight and what's going on with them. So as far as how to score it, it's very simple. It's 1 to 30. 1 to 10 is minimal nervous system dysregulation. Maybe they're pretty good at regulating their emotions in their body. Uh, 10 to 20 is persistent. So this is something that's chronic, and we really need to work on some coping skills or get a better idea of why this is so chronic. And then 20 to 30 is pretty severe. So this is just kind of a springboard into, hey, we need to look into this a bit further. So I'm happy to give you guys a copy of this if you want to use it.
I would love
Maybe
it.
it's
I would love that.
Okay, cool. That being said, too, if y'all have any edits to it, you're like, you should add this or take this away. It is a working document. It's so feel free to give me any feedback you might have.
Anna, this is awesome.
It
Yes,
is. I mean, I like it.
I would
Impressed.
love a copy.
Me too.
Awesome. Well, I'll be sure to do that. I'll print some off, and whether y'all use them in session as you're taking notes, or maybe you're just trying to think through a case, it could be kind of helpful to just get a better idea of what you're looking at.
Go,
Okay.
girl.
I'm going to take the test.
Me too. Trust me.
Yes.
We don't find this work just out of curiosity.
Right, right.
Um, so this is just a moment. If y'all do have any thoughts or insights or things that you want to share, feel free. If you don't, that's
I,
okay too.
I wanted to ask, I had written it down a minute ago. And you were talking about the vagus nervous, the nerve that kind of runs through your body, and I guess maybe helps regulate your nervous system some. And you were
Yes.
talking about how to, like you said, you were saying there's ways that you can help stimulate a client, like when they're in session, to help them stimulate that to get it
Yes.
going. So what are some ways, like, I mean, would it just be as simple as like the deep breathing? I know you said rub the ear or something, like, so I wanted to get what were some ways that you do that?
Yeah, that's a really great question. To be frank, one thing that I do in many of my sessions, not all, just depending on my relationship, but one thing I'll do is actually open our session with either a little meditation or a prayer. And
Okay.
the reason being is it kind of helps to set the tone from the beginning. Regardless of, the stress of getting to the session or what they're going to talk about. It's a
Okay.
way to just ground us together.
Okay.
And then just depending on what's actually going on in the session, I will engage a lot of deep breathing. A lot of movement. If they are really curled into themselves, I'll say, you know what, let's just roll our shoulders for a minute. I know this sounds crazy, but just trust me. But there are many, many books, and I can send you guys a couple of copies on. It's very similar to DBT. There's just skills and skills of different things that have worked for different individuals and different patients in terms of how to stimulate that parasympathetic response system. But to answer your question simply, deep breathing, mindfulness, meditation, prayer are mainly the ones that I use in session.
Okay. I can do that. Okay.
Hmm.
I feel funny like I'm trying to lead a little like meditation, like a guided imagery. I feel weird doing that. Like I need to practice that a lot. I think it's because I feel like I need a template to read or something like,
Yeah.
I
because I'm,
will say something that I have done a couple of times is and really after sitting in, a yoga session with you a couple of times, Anna, is on my phone I have like the Peloton app, and so they have a whole thing of meditations, and it's like 5 minutes of like different meditations. And so there have been moments where, especially like I have a schizophrenic patient that has requested meditation in session. And so he and I will start and end with that. And then so I've done it with a couple other ones, and that has been really effective. Like, because I mean, obviously, I'm probably not going to lead one, but having some that I've found that aren't odd on YouTube, but like having an app that can lead. And I think Anna's given me an app or two that are free. That's
okay.
been
I would
really
love that.
helpful.
Yeah, I would love it if you shared that with me, because I like, especially if it's like a timed one that's only like 5 to 10 minutes, I could do that in a session, and
Yeah.
I would love to do that. So yes, please share it.
Yep. I'll send you. I think there's one or two that Anna sent me, so I'll send them to you.
Okay, thank you.
Yeah,
Awesome.
absolutely.
I love that, Lindley. I don't know if I've ever actually played one in session, but I feel like that would also be mutually beneficial.
Yeah.
So I think it would be really cool to maybe just have several queued on a computer that you can go to. Um, and I will say the main meditation app that I really like, I will say it's Christian, so it depends on your client if they're open to it, but it's called the 1 minute pause.
One
And it's like a white icon with uh,
minute,
like two
two
lines in it.
lines.
But what's cool about it has meditations as short as 1 minute, all the way to like 15, 20 minutes, but they are scripturally based meditations. And I think the main like theme behind it is, Lord, I give everything to you in this moment. Help me to just surrender. And they're very, very grounding.
Okay. Oh, yeah, I would love that. The 1 minute pause.
Yes, ma'am.
Okay. I wrote it down. Awesome. Thank you for that. I feel like
Yeah,
I got some good
absolutely.
resources.
Well, I will say thank y'all so much for being a part of this.
Yes.
And feel free to say no, y'all. I do have one more meditation if you would like it.
I
But
would
if
love it.
you would, how are you feeling, Lindley?
Bring it on, girl. Come on.
Okay. So, and before I go into it, I will say, Shannon, this is one that is a script, and it's one of my favorite meditations of all time. So, if you do want the script, I'm happy to give it to you.
Okay,
But
thank
I
you.
absolutely, but I want to give you guys a moment just to experience it.
Okay, thanks.
Um, so, if you feel comfortable, maybe go ahead and close your eyes, or you can just keep a soft gaze on the floor in front of you. Find yourself comfortable in your chair. All right, take a few deep breaths. No need to change your breathing, just to notice the gentle rhythm of the inhale and the exhale. We've had a lot of information flowing, so take a moment to just allow your body and mind to settle in this moment. Now, I'd like you to bring to mind an image of yourself. You might picture yourself as you are now, or maybe at another time in your life. With a gentle heart, silently repeat these phrases to yourself, offering them as kind wishes. May I be happy. May I be healthy. May I be safe. May I be at peace. Now bring to mind someone that you love, someone who just brings warmth to your heart. Picture this person in your mind's eye and extend these same wishes to them. May you be happy. May you be healthy. May you be safe. May you be at peace. Deep breath in. Exhale. Now extend this kindness one step further. I'd like you to bring to mind someone that maybe you find challenging without forcing anything. See if you can allow yourself to offer them the same well wishes, recognizing their shared humanity. May you be happy. May you be healthy. May you be safe. And may you be at peace. Lastly, we're going to expand this loving kindness to all people and all beings everywhere, near and far, seen and unseen, human, animal, with an open heart. Just offer this universal wish. May all beings be happy. May all beings be healthy. May all beings be safe. May all beings be peace. As we close this practice, just take one more deep breath in. Slow exhale. Gently bring some awareness back to your surroundings, wiggling your fingers and your toes. And whenever you're ready, slowly open your eyes.
This is my
Baby.
look. He was, as soon as you started that, they both came and got in my lap and were like all over me. They were like, I want to participate.
Oh.
Sweet
That's
babies.
so sweet. Well, you guys, thank you so
Mm.
much for spending a whole hour with me this afternoon.
Oh gosh, thank you
Anna,
for
thank
doing this.
you. This was
Yes.
awesome.
Thank you,
it
Anna.
was,
You're the best.
y'all are the best. And if y'all need anything, have questions, please don't hesitate to shoot me a text, and I will see y'all next week.
Okay,
Uh,
sounds good.
All right.
Bye,
Bye,
Y'all have a
y'all.
good
y'all.
Sunday. Bye.